Third is actually the summary of the lecture 2, that is the description of sympathetic nervous system, but slightly summarized, especially for undergraduate, while the lecture 2 is again sympathetic, but that is more detailed. Okay, so we were discussing that the autonomic nervous system consists of SNS, sympathetic nervous system, then PNS, parasympathetic nervous system, and it also consists of ENS, enteric nervous system. Okay, now we are discussing the sympathetic nervous system. The function of sympathetic nervous system I have done in detail in lecture 1. Now I am discussing now the anatomy of the sympathetic nervous system. Anatomically, the sympathetic nervous system consists of the sympathetic chain and the lateral horn cells present in the thoracic segment of the spinal cord and in the L1 and L2 segment of the spinal cord. Look, this is, let me say, this is the spinal cord, this is the cervical segment, this is the thoracic segment, this is the lumbar segment, this is the sacral, and this is coccygeal. One segment of the spinal cord means that one piece of the spinal cord that gives origin to one spinal nerve on the right and the left side. Okay, now in the spinal cord, in the cervical region and lower lumbar and sacral region, you already know that in cross section the gray matter is arranged like that it consists of the anterior horn and posterior horn. Anterior horn is having the motor and posterior horn is having sensory. But note that only in the thoracic region, from T1 to T12 and the L1 and L2 segment of the spinal cord, only in this region, what happens that if you take a cross section, you will see that the gray matter is arranged like that it consists of anterior horn cells and then the posterior horn cells, and also present a group of cells in the lateral part which is called as lateral horn cells. The anterior horn cells are the motor in function, the posterior sensory, while these lateral horn cells are sympathetic in function. These lateral horn cells, then, the fibers come from this anterior horn, this is called the anterior root. Fibers coming from this posterior horn, this is called the posterior root. While these fibers coming from this lateral horn, these come out along with the anterior root. And then these two anterior posterior roots, they unite with one another over here and over here, and in this way that, look, in this thoracic region, look, you can see these are the vertebrae and these are the nerves that comes from the intervertebral foramen. So the thoracic nerves, as soon as it come out from the intervertebral foramen, each thoracic nerve consists of three types of fibers, that is this sensory, the motor, and this preganglionic sympathetic. While in the cervical region, the spinal nerve consists of only two types of fibers, that is sensory and motor, and in the lower lumbar and sacral, over here in this region, also the nerve consists of only two types of fibers. Okay, now that what happens, you already know that present over here on lying on the transverse processes of the vertebrae, over here is the sympathetic chain, and you can see, look over here, you look this, look, these are the ribs, these are the spinal nerves, and you can see this chain which extend from the base of the skull up to the coccyx on both sides, lying along the vertebra, along the paravertebral region, over the transverse process of the vertebrae. This long chain, this one you can see, look, is made up of ganglion. Look, these are sympathetic ganglion, and these ganglion are connected with one another by these fibers, and in this way this is being called a sympathetic chain or sympathetic trunk, one on each side of the vertebral column. Look, one is this one and one is this one. Okay, now what happens, you look again, let me say, look, these are the vertebral bodies, transverse processes, vertebral bodies and transverse processes. Look, and over here comes out, from over here come out the spinal nerves, and over here lies the ganglion and sympathetic ganglion, and making the sympathetic chain one on each side, while over here lower down the two sympathetic chains unite with one another at a ganglion, and this ganglion where the two sympathetic chains unite, this is being called as ganglion impure. We call it ganglion impure, and this sympathetic chain consists of 3 cervical ganglion and 11 or 12 thoracic ganglion, and 4 or 5 lumbar ganglion, and 4 or 5 sacral ganglion, and 1 coccygeal. In this cervical region, it is said that the number of ganglion is less because the upper 4 cervical ganglion have united with one another to form the superior cervical ganglion. The middle 2 ganglion have been fused to form the middle cervical ganglion, and the lower 2, 6, 7th and 8th ganglion have been united with one another to form the inferior cervical ganglion, and usually the inferior cervical ganglion unite with the first thoracic ganglion and then making one big ganglion which is called as cervico-thoracic or stellate ganglion. Okay, and then in the lower region, usually there is one ganglion deficient. For example, there are 12 thoracic nerve, there will be 11 cervical thoracic ganglion, and so on. And then you note the point, look, this is the cervical nerve. Please bring it clear. Look, this is the thoracic nerve, and this is the sympathetic chain. Look, each sympathetic chain, is it clear, this small branch that comes from this nerve, this is actually those sympathetic fibers which are contained preganglionic. This leave the nerve, come to the ganglion, and this first branch of the thoracic nerve, that is called as white ramus communicant. These fibers relay over here, and after relay passes back. You can see this, the second branch passes back. Look over here, this is the first branch, this is the second branch, again join the same spinal nerve, and then that is this, the branch given by the nerve to the ganglion, that is white or myelinated, white ramus communicant, and the branch given by the ganglion to the nerve, that is non-myelinated or gray ramus communicant. In this way, all the thoracic ganglion and number 1 and number 2 ganglion, they receive the sympathetic fibers. Why? Because in the cervical region of the spinal cord, there is no sympathetic lateral horn cells. Then what happens? That look, that the fibers, let me say, the fibers that come out from the thoracic one, some of the fibers join and relay in its own ganglion, while some of the fibers do not relay over here but ascend upward and relay in this cervical ganglion, and some of the fibers in the lower thoracic ganglion descend downward and relay in the lumbar and sacral ganglion. In this way, all the sympathetic ganglion receive the preganglionic sympathetic fibers, and all the ganglion are ultimately being connected to the thoracic segment of the spinal cord through this way. But note point that in the cervical region, the cervical nerves do not have the preganglionic or white ramus communicant, because it do not contain the sympathetic fibers so that it can be given into the ganglion. But it do receive the gray ramus communicant from its own ganglion. But note the point that the first cervical ganglion gives gray ramus to the upper four cervical nerves, while the second cervical ganglion gives gray ramus communicant to the middle two, while the lower one to the lower two. Okay, because the ganglion are 3 and the nerves are 8. In this way, note that all the sympathetic ganglion have received the preganglionic sympathetic fibers from the thoracic segment of the spinal cord, and all the ganglion are ultimately connected to this thoracic segment, which is the central connector cells. Okay, while the ganglion then gives different branches. Now note this part. The sympathetic chain then gives what type of branches? Number 1, each sympathetic ganglion gives branch to its own spinal nerve or to many spinal nerves. And these postganglionic sympathetic fibers run in the spinal nerve, and note it is must that each spinal nerve consists of the sympathetic fibers. And then running in the sympathetic, these spinal nerves, these nerves passes to the skin, muscles, okay, and many somatic organs to supply the blood vessels, the sweat glands, and the erector pylorus muscle in the skin. Okay, they are vasoconstrictor, they are vasomotor, pseudomotor, and pilomotor. That vasoconstrictor, it increases sweating, and it stimulate the hair follicle to make the hair stand, okay, which is called as piloerection. And then in the skeletal muscles, the sympathetic, which passes along with the nerves, they are simply vasodilator. Note the point. All over the body, the sympathetic is vasoconstrictor, but in the skeletal muscles and in the coronary and into the genitalia and also into the brain, this is vasodilator, because during emergency condition, much blood is being needed by these organs. Okay. Then this is first type of branches that each ganglion gives. Then second branches which are being given by the sympathetic ganglion, they are called as visceral branches. Visceral branches, as its name indicates, these are the branches that are being given by the sympathetic chain to the different viscera. Note the point. From this cervical ganglion over here, the branches descend downward. From this cervical sympathetic ganglion, branches descend downward to enter into the thorax, and then which has also been joined by branches from the upper thoracic ganglion. Look, this you can see. This from the cervical ganglion, you can see these branches descend to the thorax, and then the branches are also given by this thoracic ganglion that enters into the thorax, upper thoracics. In this way, from this cervical ganglion and upper thoracic, branches are being given to the thorax, where it supplies the heart and the lungs through the plexuses, cardiac plexus and pulmonary plexus. Note one point, that the plexuses are being formed by sympathetic and parasympathetic both, but that we will explain separately. But over here, from the cervical part of the sympathetic chain and from the upper thoracic, the branches enter into the thorax, where it takes part in the formation of the cardiac and pulmonary plexus to supply the lungs and the heart. Then what happens that from the middle cervical ganglion, from the, look, this is the sympathetic chain. The cervical ganglion 3. From these branches descend into the thorax, being joined by branches from the upper two. While from the lower thoracic ganglion, the branches descend. Look, this is the diaphragm. This is the diaphragm. The branches descend, pierces the diaphragm, and enters into the abdomen. And there are 3 nerves that are the branches of the lower sympathetic chain, from the ganglion of the lower sympathetic chain. One is number 1, the nerve given branches to, and number 2, these are visceral branches. Visceral branches from the cervical region are given to the lungs and the heart, while from the lower thoracic, branches are given that enters into the abdomen, and these branches are called as great splanchnic nerve, that the greater splanchnic nerve, then this is the lesser splanchnic nerve, and then the lowest one is the least splanchnic nerve. Greater splanchnic, lesser splanchnic, and least splanchnic. These 3 nerves passes from the lower thoracic by passing through the diaphragm and enters into the abdomen. And now note this point, that these fibers that are coming from the lower thoracic ganglion, they are actually unrelated in the sympathetic chain. They descend downward unrelated. And what then they do, that then in the abdomen, there are present, look, this is the thorax, and then this is the abdomen, and these are the limbs. These nerves come from the thorax, enter into the abdomen, and over here there are ganglion, celiac ganglion, then para-aortic and renal and superior and inferior mesenteric ganglion. So these 3 splanchnic nerves, along with the branches from the first and second lumbar nerve, which is called a lumbar splanchnic, these are called as greater, lesser, least splanchnic. These relay in the ganglion, for example, celiac ganglion, which is present along the celiac artery, the superior mesenteric ganglion and inferior mesenteric ganglion, okay, which are present along the superior and inferior mesenteric artery. Then from over here, after relay in the celiac ganglion and in the superior and inferior mesenteric branch, the branches, postganglionic branches, passes to the nearby viscera. For example, you can see over here from the superior ganglion, over here lies the stomach. It will enter into the stomach, into the duodenum, and into the biliary system. And from the superior and inferior mesenteric ganglion, the branches will go to the derivatives of the midgut and hindgut. And in this way, the visceral branches of the sympathetic chain are the cardiac, pulmonary, greater splanchnic, lesser splanchnic, least splanchnic, and the lumbar splanchnic, and these supplies the heart, lung, and all of the intestine. But first these all nerves join with the parasympathetic and make plexus. And in the abdomen, these branches reaches to the nearby viscera, usually by hitchhike along the blood vessels. Okay. Then the third type of branches, which are given by the sympathetic chain, they are vascular branches. But before we go into the vascular branches, another part I must clear it, that some of these splanchnic nerves, less number of splanchnic nerves, do not go to any of the ganglion, but some of the fibers direct reaches to the adrenal gland, which is present over here at the top of the kidney. And these nerves, they reaches to the adrenal gland, and it is said that some of the cells of the adrenal medulla, these act as a ganglion. And these fibers, this is special exception. And these fibers then relay over here. Okay. Then the third type of branches are the visceral branches, the vascular branches. The vascular branches are those branches of the sympathetic chain that are being given to the blood vessels. Now note the point. In the limbs, you can see there are present blood vessels, but these blood vessels are being supplied by some spinal nerves which contains the sympathetic chain. For example, let me say the brachial artery. It is being supplied by branches from the nearby median nerve artery because the median nerve also contains sympathetic. But in the area of the head and neck, some branches are being given specially to, look, this is the vertebral artery, you can see this one. And over here is the carotid artery. So, special branches are given by the cervical sympathetic ganglion to the carotid artery and to the vertebral artery. Both these arteries along with these sympathetic nerves enter into the skull inside the cranium. And over there they form the sympathetic plexus, carotid sympathetic plexus around the carotid arteries. And then these sympathetic nerves travel and ultimately reaches over here to the orbit, and over here it supplies the pupil, where it is pupillodilator, and it also supplies the levator palpebrae superioris muscle, the smooth muscle part of levator palpebrae superioris. And these fibers are usually coming from T1 level. That's why it is said that any trauma or any tumor passing over the T1 level, it will produce a condition which is called as Horner syndrome. There will be drooping of the upper eyelid, and the pupils will be constricted. That is because the disease is at the T1 level of the spinal cord, and there is compression over the sympathetic chain over here. Okay, and in addition that the fibers are also given to the big vessels, to the aorta and the iliac artery and the femoral artery. These are the vascular branches. Okay, in this way the sympathetic chain consists of, it gives branches to its own nerve, it gives the visceral branches, and it gives then the vascular branches to the vessels. Okay, this is the summary in the then. These are actually the efferent part of the sympathetic chain, while the sympathetic chain also consists of the efferent part. And look, you can see the efferent part. Just look at this. This efferent part, look, you can see this is the skin, for example. From these efferent fibers, it passes along the dorsal root and then passes through the dorsal root ganglion and then enters into the dorsal horn of the spinal cord. And over here in the dorsal horn of the spinal cord, when these efferent fibers passes from the viscera, then two type of function it perform. Number one, if for automatic reflex, then automatic reflex means, for example, if food reaches to the stomach, then the stomach immediate contraction. Why? The information from it goes to the efferent pathway to the spinal cord, and over here there is interneuron from the dorsal to the ventral root, and then through the efferent pathway, the stomach is being ordered to pre-start contraction and also secretion. And then second is for the pain. And the pain pathway then it is the same, it is ultimately being transmitted to the higher center as well. That is the efferent part of the sympathetic system. Okay, this is in short about the sympathetic nervous system. Thank you very much.